Hello, this is Solomay Tibabu, host of the Going Digital Behavioral Health Tech Conference. I'm so excited to have Barbara Wachsman here. She is an advisor at the private equity firm Frazier and also seasoned executive in all things healthcare, employee wellness. And thanks so much for being here, Barbara.
Oh, you're welcome. I'm glad to be here.
Can you tell us more about your background, please?
Sure. First of all, I'm so happy to be here and talk about employee wellness and behavioral health is just so important. But I'll tell you first a little bit about my background as it is pertinent to what we're going to be talking about today. So, first and foremost, I'm really a healthcare person. I come out of the program at Berkeley in public health. But I'm also a business person and have worked on really all different sides of healthcare. Worked for a health plan for a while, ran a consulting practice that supported physicians. So I'm probably one of the few people out there that can see healthcare and the success and the problems from all three different angles, which is the purchaser, employer, health plan, the provider, the physician, the hospital, and the consumer. So most of my career was spent working or running large consulting practices for large companies, but really the most exciting time I spent was the last decade or so working at Disney and handling and creating a strategy for healthcare, which was one of the most exciting things that I've ever done. And then of course, today I work in private equity, but that's kind of it in a nutshell.
I was wondering how you were going to cover your background because so much incredible experience in every facet we're going to talk about. So let's start with, so you mentioned you were the Director of Strategy and Engagement for Enterprise Benefits at the Walt Disney Company. So I'd like to ask you a couple questions about that. Sure. What was it like evaluating digital health platforms for this, what I can imagine is massive and diverse employee base?
That's such a good question. And I know that you work and cultivate startups. And of course, thinking about how large employers think about offering new technology, new ideas, new ways of interacting with consumers is really important. I guess there's kind of a good news, bad news to that. The good news is that employers and employers like Disney with big brands are always looking for new, interesting, innovative ideas. They're always looking for ways to have more healthy, productive employees. The bad news is you're working with these big brands who are very conservative and kind of apply the same techniques that you would to purchasing other things, I don't know, like paper towels or something like that. I mean, you are looking at the company and evaluating whether or not it's a stable company. Of course, you're looking at the product to decide, does this really meet the needs of our diverse workforce? And of course, what we do on the strategy side is look deeply at our company and what the needs are. And a company like Disney with just a variety of business units, you have everything from a landscaper and a housekeeper in the parks to very highly paid talent at the studio. And for Disney and for a lot of big companies, equity is extremely important. We're offering the same benefits at the same price to everyone. So you want to make sure that what you're offering will really appeal to that, broad range of employee base, and something that is affordable is extremely important. So you're looking at your own data to decide, where are the things and what are the things that we really need to address, and then finding a company that really fits those needs. I mean, that's a very broad brush answer to your question, but I think the beauty and again, the difficulty in working for a company like Disney is that there is a huge brand that is typically very protected. So they're going to be fairly conservative, fairly slow moving, and they are going to dive deep into every single thing you do.
Really great insights. And so also at Disney, I believe you developed the largest value at primary care based direct contract deal. Can you talk a little bit more about what that entailed? What was some important criteria that had to be in place before even pursuing such an effort?
Yeah, well, you're going to have trouble stopping me on this one because I love to talk about it. It was extremely important, and I hope that it's a signal to other purchasers around the country that this is something you can do. And there are others that have done something very similar. And I'll just take a little bit of a step back. I think, to Disney, our overall strategy for our population was really what we called personal health improvement. And the way that you get there, we firmly believe, was with primary care physicians, that you have this trusted advisor who is going to guide you on your journey to good health. We knew that we wanted to provide primary care services to our employees in Orlando in particular. And we were fortunate enough to have 80,000 employees in one geographic area. Disney actually has the largest geographic population in the country of any employer. And to be able to sit down with the providers directly and talk to them about how important primary care services were, to be able to identify the right physicians, the right services for our specific population. And fortunately, again, because of the leverage that we have in the marketplace, we did find providers that were very interested in understanding the needs of our population, in tailoring their services to the Disney employee. And as of today, it is very successful. We worked with 2 hospitals. We had a competitive model, 2 big health systems, I should say, that included both physicians and hospital services. Both hospitals are doing very well financially. Disney is saving money. And most importantly, the employees really love it. So I would say very successful. And again, for those listening in that are healthcare providers, I don't know if it's very often you can say there's a win-win-win among payers, providers, and the customer. But in this case, there was. And, you know, it was much easier for us to directly speak to the provider community versus having to talk through a third party. And by that, I mean having to talk through an insurer or a carrier. We were able to talk specifically about what Disney needed. And most importantly, we were able to provide the data about Disney to providers. We were able to describe the risk that they had in taking care of our employees, as well as define certain performance measures that said, hey, look, this is really important to us, taking care of diabetics, helping people who have heart disease, making sure that behavioral health is included in every single thing that you do. It was easier for us to talk directly to them as opposed to having to go through a third party. So that's why we decided to go direct, and it was terrific. And I encourage everybody to take a look at that.
Really remarkable. And you mentioned payers. If I could ask you a little bit about that. So you have a ton of experience with managed care as well. What do you think the biggest challenges are for us to make progress in expanding access to behavioral health?
Boy, that's such a good question. And, you know, using the term managed care, I think for a lot of people, they think about restrictions, they think about gatekeepers, they think about less access. They think about not being able to go to the provider that they want to go to, when in fact, to me, managed care really means, again, working with that trusted advisor who gets to know you and can direct you to the right provider. And when you're talking specifically about behavioral health, and I know that we're going to talk about the digital front door of behavioral health, which is changing everything. But when you talk about behavioral health, your physician or your trusted advisor is going to understand who you need. Do you need a psychiatrist for medication management? Do you need a psychologist? Do you need someone for your child? What exactly do you need? Heaven forbid you need inpatient care. So in fact, managed care to me is really having a guide, having someone who can help you understand what is it that I need. Now, this may be somebody who you can immediately pick up the phone and talk to. This guide could be in any number of forms, but I think when I think of managed, I think someone who is there to support you. At Disney, we use the term having a advisor who will wrap their arms around you. And that could be a physician, it could be a nurse practitioner, it could be your therapist who says, look, I know that you need more services than I can provide to you today, and I want to be able to send you to the right place at the right time. So managed care to me is a very positive thing. And it means, working with professionals who have your best interest at heart. And I do think it's important in the behavioral health world as well, although I know we'll talk a little bit more about the important features of great behavioral health benefits. And one of those is immediate access. You want to be able to, whether you're talking to a trusted advisor or trying to find someone on your own, you need someone who is going to be there for you when you need them. I'm not sure if that answered your question totally about managed care, but I definitely want to put a positive spin on it.
No, that's great. In fact, that's a great segue into this next question. We've heard a lot of priorities from employers around access, as you mentioned, face-to-face versus digital. So, in addition to access, can you talk a little bit more about what are some of those core priorities for employers in terms of great behavioral health?
That's the $1 million question that every single startup in this space should be asking and should understand. What is it employers want? What is it that the purchaser wants? Obviously they want access. They want to know that if someone needs care, that they can pick up the phone, they can log in, they can go through a portal, and they will find someone to talk to, and someone who will either guide them or be able to provide that care when they need it. That's important, access. And right now you'll hear a lot of talk about problems with access for psychiatrists in particular, for pediatric psychiatrists, for therapists in certain communities. I actually think we don't have as much of a problem as we have a problem with payment, and that is a whole other discussion. But I do think access is important. I think from the employer perspective, what we can do to encourage better use of behavioral health are things like work with a benefit design that's very open, that allows somebody to get as much care as they need when they need it. At Disney, we really revamped our entire benefit design around mental health. We eliminated any barrier to getting care. There was no limit to the number of visits you can get. I mean, the smart employer says, we want you to get as much behavioral health as possible. This will do nothing but have a very positive impact on your productivity, on your happiness, on your physical health. So I think the employer needs to make sure that there is access by, frankly, making sure that the payment for providers or the payment for a digital venture is adequate to be able to attract the kinds of providers that you really need. And then I think also to have a benefit design that's very open and encouraging, where there are no hurdles. And then finally, in terms of cost to the consumer, to the patient, to the employee, whatever we want to call them, it's extremely important that there is not a hurdle there. And frankly, at no cost should somebody be able to access care. And there are absolutely easy ways to design this within your benefit plan. So again, I think anything you can do to eliminate a hurdle is really the thing that employers need to think about when they're offering great behavioral health.
But what about ROI?
I'm not sure if you're saying that with a with a smile on your face, or because I will tell you that depends on who you ask when they talk about how important ROI is. And I think that as your audience talks to purchasers, as you go out to talk to the larger purchaser and the more sophisticated purchasers that deeply understand healthcare, I think they also realize that ROI is something of a specious metric. You can make ROI whatever you want it to be. It really depends on what's in that number, depends on what the denominator is. And I think a lot of people kind of, will not be so concerned about an ROI. That said, there probably is a group of employers that may perhaps report directly to a CFO who does need to produce an ROI, does need to say, hey, we're getting at least $2 worth of value for every $1 we're spending. And I think most of us can develop an ROI, out of nothing. I mean, you can find an ROI for anything. I think part of the problems with ROI is that you are giving someone a number that is not based on their population. You're giving somebody a number that, again, you don't know what has gone into that number to actually determine what the expenses are. So I think it's something that you should be prepared with a number in your hip pocket when you're out there talking to purchasers. But nobody is going to ask you to guarantee. Well, I shouldn't say that. Let me take that back. You might find a purchaser who wants a guaranteed ROI. So I would say, think very carefully and deeply about what you're going to put into that number and make sure that you can actually deliver on that before you would ever even entertain the conversation about it. But again, I think you're going to find healthcare people that say, look, We know that value in healthcare and in behavioral health is created over time. We also know that the things that matter to employers, which is high quality, low cost, and or I should say affordability and a great customer experience, don't necessarily create or result from a certain ROI. Healthcare is a complicated service, and it takes quite a while to create that value. So it's a good discussion to have, to understand how people think about it, to have something in your hip pocket, but not to worry so much about it.
Really great advice. Anything else for the startups in the audience that you could offer in terms of what they should be thinking about if they want to approach an employer with their solution?
Oh my gosh, I could talk to you about this for hours. And I know that, this is the end of a long day for you and for your audience. First of all, they really, really, really need to understand how employers think and how they purchase. And these folks are different from anybody you have ever talked to in the past. They are concerned about disruption. They are concerned about the employee experience. Yes, they're concerned about cost, but they're also concerned about quality. They take forever to make decisions. They're, especially now, during COVID, I mean, my heart goes out to startups that have had to suffer through the past year with no in-person meetings, with the difficulty of talking to employers who are more concerned about getting their employees back into the building, getting them back to work, rebuild after layoffs. I mean, it's been a very difficult year, but I think, slowly employers are going to need to rebuild their benefit lineup, and behavioral health is number one. But I think understanding, these are folks that may use procurement, may not, may use brokers and consultants, may not. It's a long and arduous process. There is absolutely a calendar for this. Most employers are looking at the start of the year. They're looking back at the performance of their plans. They're looking forward at what their employees want. They're going to spend a couple of months during the spring, probably kicking tires, vetting new ideas, looking at folks like the folks in the audience today. But come mid-year, come July, come August, they're actually locking and loading everything they're going to be doing for the following year. This is the time where they start working with their benefit administration team. They start, coding the software for their open enrollment period, and they are done. So it's a very long sales cycle. For folks in the audience that have investors that are getting nervous, they need to take a big breath and understand that this takes quite a while. The benefit, though, on the back end is so tremendous. And I'll just go down a little bit of a rabbit hole. In my decisions about my career, once I got out of grad school and I knew that, I was a healthcare person, I really wanted to make a difference. What I started to realize was the employer in this country is the one that determines the kind of care that's delivered, how it's delivered, how much it costs. Employers have such a huge role to play in helping employees, helping customers deal with things like mental health. It is just the most important platform to get involved with, to sell to. I mean, it's employers and government programs that deliver care in this country. So I would encourage folks that have great ideas about new ways to deliver care to understand that the employer marketplace, the purchaser marketplace, whatever you want to call it, whether you're working through an intermediary like a health plan, but ultimately selling to the employer, is just extremely important. And getting to know how they buy, the time that it takes, how to pitch to them, what disturbs them, what to talk to them about, is just extremely important. And there are a lot of people out there that will tell you how to do it. The other important thing to do is to think about these large employer coalitions that are out there. Employee benefits people talk to each other. This is how they learn about new ideas. This is how they learn about startups and interesting entrepreneurs, interesting innovation. They come together as part of these coalitions and they talk to each other about it. So the Employer Healthcare Innovation Roundtable, the Pacific Business Group on Health, Catalyst for Payment Reform, the Midwest Business Group on Health. These are all coalitions that you need to pay attention to and understand how you get in front of them. Getting in front of 70 employers is a lot easier than going one by one. And they will talk to each other. I think having great references is important as well. So that was kind of a very long and winding answer to why should we care about employers and how do they think. There's much more to talk about if you want to continue on that thread, but we can go on to other topics as well.
Super helpful. Yes, we certainly have a few of those coalitions in the audience and speakers today. So there's a lot of consolidation happening in our cities. How should employers think about developing their portfolio of healthcare solutions? Should they be looking more at platform companies that have all the modules, or should they attempt evaluating many point solutions and curating their own solution set?
Oh, you are so smart. That is probably the most important question to think about, try to understand, and deal with out there today in healthcare. And it's a perennial issue that has been out there forever. The question is, do we want to have the employers asking themselves every couple of years, do we want to have one platform? Do we want to have, one overarching solution that everything kind of fits into, including one owner? I mean, it used to be you'd work with one big health plan who would offer all these individual components to you. Or do you want to go best in class? Do you want to have that lineup where you are vetting and thinking about every single solution and how it best fits your culture and your company? That is the big perennial question out there. And there are pluses and minuses to both sides. I think we are on the tail end of some fatigue over the multiple solutions, having the 10 different startups in your benefit plan, each one that has to be administered differently. Most importantly, each one that has to be communicated, each one that has to be contracted with. I think employers there is a little bit of fatigue out there. And I think that's why you're starting to see kind of the classic business cycle as well, where you're starting to see some consolidation. You're seeing Accolade by 2nd.MD. You're seeing, grand rounds, snapping people up and trying to consolidate onto one platform, because they are hearing from the purchaser, we just can't manage all of this. Remember, benefits departments are small. Probably the most important thing that I can tell your audience also is that their benefits are an expense. These are not folks who are driving revenue in the organization. These are people who are trying to save you money, but ultimately are spending, 25% of your HR budget, or 30% is on benefits. At Disney, we spent $2 billion with a B dollars a year on benefits. So we are an expense. And trust me, the staff is small. The budgets for you to be able to administer these plans is relatively small, and you're constantly asked to do more and more. Not only are you running your benefit lineup, you're doing your strategy, your operations, your administration, but now you're trying to figure out how to get people back into the office. Now you're trying to figure out how to purchase plexiglass. Now you have a second job. So it is very difficult when you're asking an employer to carve you out and have that one little specialized program, as great as it is and how much you love that baby, for a large company that's got a lot more going on. It's very difficult to get the idea that you're going to carve them out. Just thinking about the way benefit managers think is important, because there are solutions. You're going to be that perfect solution that might want to come under the umbrella of a master service agreement with the carrier, or you may want to partner up with someone where you are moving referrals back and forth seamlessly. So really the employer isn't seeing this as entirely separate offerings, but you are part of an overall ecosystem. Even if you really say, look, we are so special and we can do so much for you, we need to talk to you about working with us. The thing to remember is you've got to integrate with everything else they do. That might just be better communications. It might be deeply understanding every other program they offer, so you can speak to, gee, how are we going to fit into your medical plan? Oh, hey, what if somebody actually needs to go to a highly specialized referral for an eating disorder? Who are they? Where could I send people? How would we make that seamless for the employee? So, it's not to say that these incredibly innovative, interesting, smart companies out there can't go up and say, look, I've got this very interesting solution for you. But I think always thinking about how the employer is thinking, how the benefit manager has to work. How can this be integrated into the overall ecosystem of healthcare? And look, we always need to think about healthcare in a very holistic way. I mean, it is physical and mental well-being. And I think going in and talking to your purchaser with that in mind, and then actually taking that down to the very specific level of how am I going to integrate? How am I going to warm transfer? How am I going to be able to tell that person about everything, for example, that Disney does, even though I might only do one piece of it, will be music to the benefit manager's ears. You'll have them eating out of the palm of your hand and saying yes to you.
So where do you think the future of employee wellness is going?
Well, that's, I gave a talk, and this is now a couple of years ago, to a very big audience of health plan people. And the first thing I said was, wellness is dead, but long live wellness. And the guy on the platform with me looked at me like, oh my God, what has this woman said? But it is true. I mean, the more traditional ways of thinking about wellness, it's a gym membership, it's a weight management program. These, I think employers, again, because of this reluctance to have all of these point solutions, are looking for a wellness program that is far more holistic. I think, looking for a wellness vendor that, one, can meet your employees where they are. So that means that you are offering a digital front door. You are offering synchronous and asynchronous ways to interact with people. You have, a variety of providers that can care for your employees, but really where they understand it is connecting with your physical well-being. So you are going to help with chronic condition management. It's with, of course, mental and stress and anxiety reduction and mental health support. It may even be about financial wellness, although I'm going to set that aside for our next conversation down the road. That is people do suffer tremendous anxiety from financial problems, but not so easy to solve. But I will say, I think you've got to take a very holistic view. You've got to have things that you offer for everybody and a way for them to access these programs. As I said, whether it's a digital front door, along with seeing people in person, which is a great topic for our next conversation somewhere down the road. Are we going to continue to see virtual care? Are we going to have more? Are we going to have less? We're already seeing a decline. What does this mean for the delivery of care? But I'm just, so thrilled that your audience really is thinking about the future of healthcare, the future of behavioral health, because truly there's nothing more important if we want to have a healthy, productive workforce.
Barbara, this has been so incredibly insightful. Thank you so much for sharing your experience with all of us today. So helpful. Really appreciate your time as always.
You're welcome. It was delightful talking to you.